thanks for coming to the class. I think I'm going to thank the students for finding time to be in the class. Attendance is not mandatory, so I don't mind. It's your choice. Anyway, let's begin with another important topic, viral hepatitis. And I think you must have figured out by now that many a times, especially infectious diseases, is something that we really want to rely on current updates. Remember, textbook information many times takes at least 5 years to appear in scientific journals before they will be accepted as a fact. And the only other site that keeps updated with infectious diseases is CDC. And many a times I normally do take data from CDC. And hopefully, I think I did communicate to quite a few. I'm going to talk about it tomorrow as well. I'm going to also offer an elective this fall for current topics of infectious diseases. So you'll listen to me tomorrow. But it's usually a discussion-based kind of a elective, which usually many students may find it easier. But anyway, viral hepatitis, and you can see from the pictures over here, basically represent what? So these are actually not random pictures, but they are impact slides as I normally use in my opening lectures as well. This actually shows you the modes of transmission. The modes of transmission of viruses, especially hepatitis virus. That represents MEM, men having sex with men, MSM, sorry. Then there's like vertical transmission, transference, heterosexual relationship, and then typically something happening in daycare centers. Daycare centers, when you put, especially babies, when you put babies in daycare centers, this is one of the, the places that you should expect quite a few infectious diseases coming up or having a higher incidence. Anyway, let's begin. There was a time we had. Say it again? WSW? Okay. Women having sex. Okay, all right. You may want to take my elective for infectious diseases. We'll talk about that. I have a slide. I will show it to you once in a while. You just have to be a little bit imaginative of what happens, but I do have one slide that will come up later, and we'll talk about that. Yeah. I mean, it's just like a CDC description, but I can definitely call them up and suggest that we want to add one more. All right. Anyway, that's what they call thinking outside the box. Something we want to develop in students, thinking outside the box. Anyway, there was a time where we used to talk about viral hepatitis. The major classification was infectious and serum. Doesn't mean anything though. When you used to say infectious, that meant A, and at that time we used to say B and D, because many a time B and D would occur together. And then there was a category at that time, non-A, non-B. It's called non-A and non-B. We now divide them into many different hepatic viruses that are coming up. E, again, enterically transmitted. That's where the E comes from. And then C, parentally transmitted. And many others are coming up as well, because remember, viruses have this tendency to mutate. Okay, this is the master slide, and it's like 50% of the lecture. And if you understand this one, you actually will get all the information that you need to know from today's lecture. Now, I want you to pay attention to the columns, and then we're going to go in rows. If you pay attention to columns, source of virus, route of transmission, chronic infection, and prevention. These are some of the things that we really care about. And then we have A, B, C, D, and E. So these are some of the viruses that are there. And typically, In subsequent slide, you'll see HAV, HBV. So H stands for hepatitis, and V for virus, and then middle is that specific virus. Now, source of virus. You can see source of virus over here is feces, A and E. So these are typically infectious, and source of virus is usually orophycal contact, right? So feces, and then we have B, C, and D, basically blood or blood-derived body fluids. So these are the basically source of viruses. That's where these viruses are communicated. So blood or blood products or blood-derived body fluids, that would include quite a few platelets and dissolvents, many other serum components that we may want to give to different sets of patients. Again, you can see route of transmission, fecal oral, and you want to put them together. And then we have BCD as percutaneous or permucosal. So remember, these are the two basic barriers for our immunity, skin and mucous membrane. And these viruses, if given a chance, would enter our system via skin, if there is an abrasion, cut, or if there is some again, the opening in mucosa. So remember, we talked about STDs as well. Now, chronic infection, that's very important. The reason is that liver happens to be one of the vital organs. If you do have an acute infection of liver, that again is very serious. Many times we usually talk about jaundice, and the symptoms of jaundice are usually very acute. Or you may have a chronic inflammation. Hepatitis means inflammation of the hepatocytes. So chronic infection means that chronic infection of the liver, and that can go into chronic hepatitis or can go to cirrhosis. What is the commonest cause of cirrhosis in this country? Alcohol use of alcohol. So other than alcohol, we have these different viruses as one of other common sources of causing viral infections. So you can see, as far as chronicity is concerned, there is none in these one, but there is definitely a chronicity element. So if a person does have a B, C, and D, the chances are that this viral infection is going to stay in the system for the rest of their life, and the person may be exposed to chronic hepatitis or even cancer, because cirrhosis can also lead to cancer. We'll talk about that in a while. How do we prevent it? For prevention, we may have a pre or post exposure. For pre and post exposure, we can kind of give prophylactically some of the vaccines available that would stimulate your active immunity. For post, we usually give immunoglobulins that's going to help you to fight those responses that your cell-mediated immunity will have. So there are vaccines available for pre and post. And then again, for this one we do not. All you need to do is, this is something that's waterborne. That's another thing, waterborne, and that's hepatitis E. So you must ensure that you're taking in a safe water. As far as this is concerned, again, there is a vaccination available. For these ones, there are other things that you can do, especially, say, risk behavior modification, because many of them are sexually transmitted. So again, same pattern, same problem, same risk factors as we have for different STDs. This is one of the STDs that are of viral origin. Remember, we talked about HPV, papilloma, we talked of simplex, and there's another thing that can also be transmitted by that route. All right, let's move on. As far as estimates are concerned, so you can see A virus, B, C, and D. You can see pretty much higher incidences of quite a few viruses, and there is also deaths reported for, you can see from here, HBV. But the chronic infection, you can see the rate of chronic infections are very high. There is no chronic infection for these two, or we don't have any reports. But this one, you can say 1 million, and it's about 3.5 million. That's a very high. And it's very important for you to know, because you're going to be exposed to all these things. You're going to inject people, and you're going to may have accidental pinpricks and so on and so forth. So that again is something that you really need to consider when you're working in health professional or in the pharmacy. Chronic liver disease deaths per year. So you can see there's a very high, again, 5,000 deaths per year or 8 to 10,000 deaths per year because of these two viral infections. Okay, this is how a hepatitis A virus, look, if you remember, we did talk about hepatitis A virus before as well. Do you remember?